Hi, Paula.
Hi, Damien. How are you?
I'm fine, thank you. So, thanks for giving me this opportunity to interview you.
You're
Just to
welcome.
say that I'm Damien. I'm a psychotherapist in England with about 22 years working in mental health and addictions. Um, but with with an interest in Qigong, and yeah, part of why it's an honor to interview you is you've been my teacher. So yeah, I don't know if we could start, Paul, just by saying a little bit about who you are and what you're currently doing. Your professional role in terms of Qigong and traditional Chinese medicine.
Okay. So, well, first of all, thank you. It's a pleasure to be here talking to you. Usually it's me interviewing other people, so it's really nice to be here and talking to you, especially about mental health, because it's something that I really, really like. And I think Qigong can help a lot. But first of all, my name is Paula Madeira. I currently live in Portugal. So I didn't start with Qigong. My first degree was done in Nottingham University. I did plant science, and then I sort of changed everything, came to Portugal and enrolled in Chinese medicine. This school is special because Qigong is part of the program, so it's compulsory. So I did this for 5 years. And during that time, because I got more or less addicted to Qigong, I really enjoyed it. After a year, because I was training so much, I was invited to start teaching. So I started teaching about, it was 96, I think. 2004, I started the Qigong training or instructors course, which is a course that I run to the date. So it's a 3-year course where I train students from zero to a point that they can, go out and be professionals and help others with a big component of TCM. So we opened the course in 2004, and then in 2006 came this opportunity to study in Thailand. So I went to study with Mantak Shia, and the way that he teaches and the subjects, what really I thought it would help me a lot was all the healing love, because at that time I started teaching gynecology in school. So I thought that the fusion between TCM and Qigong in that specific area would help me a lot, and it did, and it's something that I do till the day. So I'm specialized in gynecology and andrology, and I use a lot the Qigong exercise, especially Mantak Shia, to help alongside with the herbs and acupuncture to improve certain conditions. So yeah, I think that's it about me.
Oh, that's great. Yeah, I mean, before we sort of move on, could you just very briefly, if anyone's completely new, just say a little bit about what does Qigong mean? Because obviously this is something that's been really important to you. So what is Qigong? And then perhaps we could start to look a little bit more at around, because what is Qi? What are the functions of Qi? And if you could give a real, I mean, obviously health and physical health is really important, but try and give it a psychological perspective as well.
Okay. So Qigong, first of all, is formed by two parts, ideograms. One is Qi and the other one is Gong. Qi is basically all the energy that we have around us and inside of the body. So this is what make us move, is what make us wake up in the morning, is what make us sad or happy. And basically it comes from the food that we eat and the air that we breathe. So we combine these two, and then we have the chi. We can have good chi or bad chi. So this is basically chi that is everywhere. The chi then combines with many other things like shui, which is the blood, but that is another section. Then we have the gong, and the gong is the way that I work that energy, the hard work that I need to do to make that energy to flow or be focused in one part of the body. So Qigong is a hard work, consistent work that we need to make in order for us to feel better, to unblock the energy from the outside. And one of the things that is very important that Qigong gives to us is the connection between the outside and the inside. So when I practice, I can bring the energy that is around me to my body and from my body to what is around me. So I can absorb energy from the sky, from the stars, from the ground, from the plants, from people around me, and I can give to them. So how do I do this? The base of Qigong is we have three main principles. One is breathing, which is basic. The other one is the focus. So imagine if I move my shoulder just like this, I'm just moving the joint. Now, if I put my attention, which is the third one, to the point, and then when I move, I inhale slowly and then exhale, is a completely different method. So I'm using the focus of my energy, attention to this point that I want to work. I breathe always slowly, which is going to have an impact on my nervous system. And then the movement, which most of the time is slow. So this way I can work the chi inside and outside of my body.
Brilliant. So the core bits then are breath, movement, and attention, intention. So how does that get disrupted? I mean, I was thinking very much around especially around childhood experiences, do difficult experiences disrupt the flow of chi? Do people, have difficulty cultivating energy, or what happens if that energy gets stuck?
So by definition, the Taoists and the Chinese define health as a way that the energy inside of our channel. So let's go back. We have 12 channels. Each channel or each pair of channels is connected to one organ. So imagine an irrigation system, the old ones where we do these ditches, small ditches on the ground, and where the water goes by. So if in all the channels the energy moves freely, we don't have any disease. We are healthy. If on the other hand, there is a blockage somewhere, then in either one channel or a few, then we can develop disease. Now, when this energy gets disrupted, it can get disrupted by many things. One of the things in terms of mental health is how I absorb the input that is given to me from the outside, for instance, from the parents. Until 7, the child is very much connected to the outside, okay? And then because of the education, there is more input, there are more rules that he needs to follow. If you give the same suggestion or rule to 2 children, and you have children, you know that, they are going to absorb in different ways. One is going to be, okay, I'll do it. And the other one is, oh my God, this is And that became, or is the beginning of a trauma, because it got very sensitive. So that can be a way of disrupting this energy. Now, we inherit a lot from our parents, and then a child is always a white canvas. Depending on the education, we're gonna build the blocks that will eventually will give an adult that walks in some way, positions the body in a certain way, and with Qigong we can read that and readjust. If you give always the same suggestion to a child and he thinks that you're being very harsh, he's going to develop, either the body is going to grow around and give a certain position. For instance, if the child has a tendency to be sad for something that you tell, the chest is going to be like this, okay? While if the other is nothing to do with him, is more open chest. So these small things can disrupt the energy inside of the body. But that has also to do with the way that we are not only brought up, but our background. How were our parents? How was the energy from the parents passed to the child? For instance, if you don't have any energy, if you are in your 70s, and if you want to do a child, the chances that that child has a basic energy, Jing energy, weak, is going to be high. If you just came out from a chemotherapy and want to give birth straight away without taking all the toxins from your body, you can be passing those toxins to the baby. And the Jing, it's called Jing, the base energy that we pass on from one generation to the other, is going to carry that. So either already came damaged or can be damaged during pregnancy. And that is what the child is going to live with. It's more or less like an inheritance. We can inherit a lot of money and then we spend it all. Or we can have a small inheritance and take good care of it. So the way that our brain works has a lot to do has a lot to do to that energy that is passed on to us, but also my building blocks. How do I digest the input that is given to me?
Okay.
So that is more or less what we have in terms of
but
our child can create a trauma or not. One of the things that I didn't say is a little bit more specific. All these traumas and what we can see in the body. So the traumas stay in a web that we have around the muscles and around all the structures of the body, which is called the fascia. The fascia system will collect, is what is like a bumper of the car, is going to absorb the traumas before they hit the organs. So that if the trauma or if the input is too harsh, is going to close, that fascia is going to close, and will pull your muscles, and then you will have a certain position. That's how we read people.
Okay, so that could be physical trauma, but also emotional trauma.
Emotional trauma.
So is that where someone doesn't have the capacity to process the feelings, they hold it in the fascia?
Yep.
Yeah, so when they deny or repress what they're feeling. And the other thing you're saying is there's a physical reaction to holding feelings, which also can lead then to like a skeletal change, holding of the body differently.
Yeah.
I think the other important thing is you're saying that our core energy, Jing, is in part inherited. So depending on the health and the balance of our parents. But the interesting thing after you're saying, and I'm quite interested because when you talked about before Qigong around absorbing energy from the environment and also kind of working with the energy we've got. If someone is born, parents are struggling or there's poor health, and then they experience trauma, can they cultivate energy?
Yes, everyone can.
So they can create it. So even if they have a deficit,
Oh,
they can start, which is really important for recovery. Thank you. So I just wanted to shift it slightly because I know a core component, in teaching with me was around the 5 elements.
Yeah.
I'm particularly interested in just an overview of what the 5 elements are and how people might use that psychologically, like, in terms of mapping someone's psychology or personality.
Okay. So the 5 elements or 5 transformations are different ways that we organize the energies. And we basically, when we talk about 5 elements, we relate to the seasons, although we only have 4, but the Chinese put an extra one, which is going to be the earth element, which stays in between the end of the summer and autumn. So it's like a long summer. So the 5 elements will be fire, which is corresponds to summer, earth, which is in between the summer and the autumn. Then comes metal, that is the autumn. Then water corresponds to winter, and then wood, which corresponds to the spring. So each one of them will have different characteristics. For instance, the wood, spring, is a time where you're supposed to start new projects, new things. The plants are sprouting, everything is new ideas, new things. You should always start in the spring. In terms of our internal map, is connected to the liver. And the liver, or each organ, are connected to an emotion, positive and negative. For instance, the wood is related to the liver, and the liver is related to anger. Or the positive one is creativity. So what we do, imagine that your liver is hyperactive. So physically, you have all these symptoms, bitter mouth. I mean, my digestions are not good. I get nervous very quickly. I don't sleep, all of that. So we're going to give you some exercises, and the aim is to change to balance and to change the negative ones. So I'm always upset. I'm always angry with people. I'm very jealous, when it gets to the pathological level. What can I do with it? Usually, when it's someone like this, I usually go back and take them to art. What can you create? What did you used to do? Did you ever play a guitar? Did you draw? Did you sing? Whatever. And that is going to dilute this big lump of negative energy. So what we do is also change from negative to positive. And in terms when we deal with mental health, that is very important, because that is one of the things that is always high, especially with the more aggressive people. So it's something that we need to lower, especially the liver, the wood element. The way to overturn that is to always include some form of art or connection, for instance, with nature. That is good. So this was one of the examples. You have all the rest. The fire, which is the summer, when it's hyperactive, is something that will give you a lot of anxiety, and is something that is very much high in this era. So we have basically the anxiety will be my heart, my fire system, which is on fire. But we also, and because the 5 elements work sometimes in pairs, so if one is up, the other one needs to bring you down. The opposite to fire is water. And usually, and the water is related to that base energy, is related to kidney, is related to procreation. So if the water is low, which these days, because we sit so much, we don't eat properly, we don't exercise, the water element, and we spend a lot of energy, computers and tablets and all of that. So the water energy, when goes down, there is not enough water, to extinguish the fire. So my fire just goes up. So in anxiety, what you need to do in order to lower the anxiety is to give exercises for that, but also to nourish the base, the water, the kidneys, so they can balance again. So this is again, if one is up, the other one is down. And then we have the rest. The earth is the most important in terms of mental health, as if most of the diseases, the new ones, because let's go back, in terms of Chinese psychiatry, they have their own pathologies, which are completely different from what we see today. And some of them, which have funky names, they sort of, today, they abandon a little bit that part. And what they are doing now is to pick up the way we divide in psychiatry our diseases and reading them according to Chinese medicine, which is very interesting. So we can pick up these 5 elements and regroup, and we can work with the patient. Imagine that the patient is taking antidepressants or mood, how do you call, mood stabilizers or something like that.
Yeah.
Okay, so you can give some exercises to enhance that part. Okay, one of the things that is on the core of most of the psychiatric diseases is a malfunction of the earth element. Why? The earth element, long time ago, so now the 5 elements is like a pentagram. The old days used to be a cross, and the earth element was in the middle. If we go back, for instance, to the representation of the channels for instance, in Thailand or some in Japan, we see that the middle or the belly button is the center of our body and is represented by the spleen, which corresponds to the earth element. In psychology, in TCM, this is the way that I see myself. Who am I? How do I see myself? How do I communicate with the others? How do I nourish the others? And how do I get nourished? How do I put my boundaries? Do I have boundaries? I don't have boundaries. That is everything to do with the earth element. And what we see when they do this work of reading, schizophrenia, bipolar disorders, borderline issues, what is always, or what is not working in all of them is the spleen, is the sense of I, who I am. And from that, and because the earth is the center, is going to have implications in the rest. But in any case of a mental problem, if you can nourish or reorganize things around the earth, the person is going to be a little bit more solid, with a stronger structure to deal with the other issues.
And I know, I'm sure, it's very much down to the individual. But if you were to offer some very simple ways that someone might build the earth element, build that sense of I, that through Qigong, what would you do? What would you say? So, some things that really help someone to ground and develop their center.
One of the things that is very simple, and I give everyone that starts Qigong, is very simple. Abdominal breathing is very basic. When you do abdominal breathing, not only you giving a self-massage to all the organs that you have in your abdomen, but you also are giving strength to your kidney. And apart from that, you lowering your nervous system starts coming down. So you have this relationship with the second brain. And what we see after 3 months of practice is that you react to your own things in a completely different way. So I give, for people that start, I recommend a lot of abdominal breathing, especially before they go to sleep, because abdominal breathing has a plus. I mean, you will sleep really, really well. The other thing that I usually do, this is Mantak stuff, is the inner smile, which is really, really good for lots of like depression, low self-esteem. It helps a lot and is very simple. We need to focus on exercises who are very simple, but give a lot of pleasure for people to do, and they feel well. And this too is something that you can see the improvement in 1 or 2 weeks, which is good.
And the inner smile is something that you cover on your English training?
Oh yeah. That and the 6 sealing sounds. The 6 sealing sounds are sounds that are connected to the 5 elements. So we have an extra one, which has to do with the triple warmer. But this is something that I use a lot, not all of them. But for instance, going back to the wood element and anger and all of that, if you just teach, for instance, the liver sound, the person automatically is going to be much more calm, and you don't need to take as many pills as you normally do. So that is really good.
Thank you. So just I know we have a lot of time, but maybe just a little bit more around regulating the nervous system. You talked about the second brain here, especially in kind of the field of therapy. There's been a real shift over the last 20 years to more somatic processes, and particularly we understand that trauma, either sort of adult trauma, people with PTSD, or people who've had lots of repeated childhood trauma, complex post-traumatic stress disorder, or sometimes people get diagnosed with bipolar or other things. There's a real dysregulation in the nervous system, and it happens. It's not a thinking process. The body is constantly scanning for danger. It sees danger everywhere, and people are either hypervigilant, hyper aroused, always looking everywhere, or closing down, zoning out. And again, just I know you've touched upon sort of the breathing, the inner smile, but and one of the leading experts, Bessel van der Kolk, has talked a lot about Qigong as a real support to people's recovery, people claiming back their nervous systems. I don't know if there's anything else you want to say around how Qigong can help with that, help with regulating the vagus nerve or the amygdala.
I think one of the things for people who have trauma is to create or find the key to a safe place inside of themselves. always starts from there. It's not the therapist that is going to give you that. The therapist might guide you there, but you need to look inside of yourself and find that place that you feel safe, which is something that people lack a lot, or because they were brought up like this, because there's constant trauma. And I do not trust myself. And if you don't trust yourself, if you never find that place inside of yourself, it's going to be very difficult to find that outside. So the first thing is to find that place, a place that I'll feel secure, I feel enough, I feel nourished, and that is inside of you. And to do that, again, we go back to nourishing the element earth, which can be done with exercises. But one of the things that I didn't say about the earth element, one of the key points is to eat properly. And when I say that, you don't need to become vegan. You just need to take away all the processed food that you eat, all the junk, just throw it away. Cook, do simple things. Now, from those things, just find something that you like, that nourishes you. Sometimes can be just a soup, something, you know, go and absorb the feeling that that gives you, and not to be afraid to be with yourself. Slowly create a safer place inside of you. And that can be done with what I gave you, the abdominal breathing can be combined with the sounds, can be combined with different ways of breathing, you know, but especially be aware of the body, the conscious that we have of our body. And one area that is very important, the tummy. Everything is around, you know, the gut, the what we have in this system. And if we work, for instance, a lot the tummy, we are going to program the intestine. And as we know, we have more neurons up here than we have here. So if the difference between this and the tummy is that here we have two parts. One is rational and the other one is emotional. This one is only emotional. So if we train this, and as you training the vagus system, you training the amygdala, you take half of the emotion from here and you divide. So you have a bigger emotional area that you can play with. And if you take a lot of weight from here, your rational is going to have more area to expand. So when you take some decision, you take from a calm place and not this confusion that we usually go through when we react very emotionally or when we are afraid of something. You just take decisions because you need to. So if we train the abdominal area, we will see that we become much more calmer in the future. So our reaction is going to be different. And that safe place also lives inside what we call the cauldron, which is the lower abdomen. So everything is connected.
That's really interesting because from a psychological perspective, the first stage of any trauma recovery is safety. You know, before you do any explorations, anything else is creating safety. And of course, it's that internal safety that a lot of people have lost when their bodies have been violated or their psyches have been violated. So I'm aware we're against the clock here, and I just I suppose I wanted to ask you a bit around, you know, how people can train with you, what that training is like. But just before then, because it's really relevant to what's happening, you know, in psychology, we're now, we're now aware of like gut health and the effect of gut health on anxiety and on depression. And I think, we were talking just a bit before around a greater recognition now around, I guess, gynecological functioning and mental health, and for men's sexual health as well, and it's often an area that's not really explored. Over here, there's been more focus on menopause, and more recently on all the things that go with menstruation and all the difficulties that people have. If you could just say a little bit, because I know that's your speciality, and especially about the impact on men's and women's psychology.
Okay, so first of all, let's go to training and then we go. So we are, so I was in UK giving some training before, but now we changed things and we have a program now that is half of it. So the theory is online, people can do at their own pace. And then this program, people come to Portugal, which is a beautiful place to come, for 1 week. So we have a retreat for 1 week. This year is going to be from the 25th to the 30th of September. So the idea is people read and do the lessons online, and then when they come, they already know the basics about Qigong, and then I'll be with them and do the practice for these 5 days. When that is over, they can go back to their own country, and we have a team that will give lessons twice a week, Zoom, so Qigong lessons. So, and we carry on for another 3 months. So overall is a 21-week training, and which is a small piece of what we do on the 3 years, but at least gives you a glimpse of what you can do. And if people want to go to the second level is when we teach about specific Qigong for men, gynecology, andrology, for cancer, for kids. All of that is on a second part. But this part we're doing like this, and we're hoping to do 1 or 2 trainings a year, which is good. And people get, connected to this big family that we already have. I mean, the course in Portugal, we're going to be 20 years next year, so it's a long time. So
and so that initial training, if someone was a therapist or a yoga teacher, or someone who just wanted to, maybe just run a Qigong movement class locally, if they complete that, they can do that, yeah?
They can do that. I forgot to say. So in the first level, when you complete the 21 weeks, you do the exam, and you're able to teach. So you start working, and the good thing is you are never on your own. If you have a problem with a patient or a client, you can always ask us, and we'll be there for you.
Yeah.
And then if you want, you go to the second level, is a bit more specific. Yeah, this training, I hope, because we not only give the movements. I mean, we have a lot of know-how how to treat people. I've been treating people for a long time, and most of my team has been treating people for a long time. We have people that just work, for instance, with cancer, others that work with different, illnesses. But it's not just to do the movements. What we bring that is new is we work a lot one-to-one. We know exactly what people need and how to combine things so they can help people.
Excellent.
So in terms of what I do, my specific work, I mean, I'm going just to talk a little bit about it because my passion. If I start talking, we're gonna be here forever. But women are very much connected. So the organ that in women is, or is always connected to women, is earth, the spleen, and that has to do with the blood. So because the spleen is on a base of forming the blood, and the blood is the base of everything in women. We lose a lot of blood, we need to replenish also. The uterus is a pool of blood. So when you take away the uterus, the person will lack some of the blood that's supposed to be there, because that pool is no longer there. Now, until 20 years ago, people thought, and the doctors, that you take the uterus and that's it. You don't need to have any more babies. You don't want to have any babies. Get rid of it. Go away. Now, we have some channels inside of the body, and one of them connects the uterus to the heart in women. That means that the emotions are very much connected to the uterus. And the blood, going back, spleen, blood, is the base for our mental thought and organization. If you lack blood, your mental way of functioning is not done properly. And when can we lack blood? When we take the uterus, when we lose a lot of blood, for instance. Oh, it's normal for you to have a menstrual period for 8 days. No, it's not. It should be shorter, because if you don't replenish that, and imagine, I have 8 days that I'm bleeding and I work 12 hours a day, forget it. You're gonna be, the energy is going to be lacking somewhere. In women, is what I've seen and work with, because I work a lot with reproduction and sometimes mental health too. This is something that women, that is very much alive and connected with women. Every time, this connection between the heart and the uterus, what says to us is, every time that, for instance, you have a relation, intimate relation, and you're not into it, the uterus is going to have that memory. So it gets to a point that the uterus is full of bad memories. And that can be sometimes the case, what is behind of some myomas can be behind, for instance, women that cannot get pregnant, or when that goes to extreme. And when, imagine that you had someone that was bleeding for 8 days, had a big lump on uterus, and the only way was to take the uterus out. If that person already had some unbalance in terms of mental stability, when you take the uterus, what is going to happen is that you might develop some problem, real mental disease. And this is something that is very important, and I always try to save women's uterus, even if they have a big lump in there. You should only do the operation if there is, for instance, I have a 20-centimeter mass inside of me. You cannot do anything. But for instance, 10, 12, save the uterus, especially if the person is not very stable, because it will eventually trigger, some could be bipolar disorder, could be borderline disorder, something like that. And that is something that we see very often.
Thanks, Bart. That's fascinating, and I'm sort of wanting to ask more questions. Just that whole thing that I guess, sexual trauma is embodied in the uterus and connects to the heart and to the mind, and the impact of that is huge. And I think some of the stuff here is also maybe what people are told is normal is not normal, in terms of women's health. So maybe something for another podcast, maybe that, for another conversation.
Definitely.
But for today, thank you very much.
You're welcome.
And thank you for the work you do, because I think
Thank you.
my experience is, it's very grounded. Often with a lot of these things, people just want to escape and get into and it's not that it's not spiritual or anything else, but it's a very grounded practice, is just what we need. So thank you.
Thank you very much for having me. And we're looking forward for the next conversation. So
Yeah.
going to be nice. Thank you,
Excellent,
Damien.
Paula. Thank you.